there's been a lot of concern about how quickly this vaccine that we're hearing about, these two vaccines that are over 90% effective, how could they do that so quickly? And I want to explain that so people understand it, because what gets us through the next few rough months is face coverings and physical distancing. That's our vaccine now. What gets us out of this pandemic is people getting the vaccine. And that's going to start rolling out here in the next month or so. But I get a lot of questions about how could that have been done so quickly in 9 months? Is it safe? When we talk about COVID-19, COVID-19 is the name of the illness that this virus causes. But researchers call this virus SARS-CoV-2. SARS meaning severe acute respiratory syndrome. CoV-2 meaning that it's a coronavirus, but kind of a part 2, if you will. My point to this is that SARS-CoV-2 is a very close cousin to severe acute respiratory syndrome. And so when we saw SARS a number of years ago, scientists were already working on a vaccine for that. So when we saw COVID-19 come to Denver and to the state back in March, and across the world, researchers didn't have to start over with trying to develop a vaccine for this, because they picked up where they had left off with the development of a vaccine for SARS-CoV-2. So I'm confident when this rolls out that this will be effective, it'll be safe, and as we move forward in giving our updates, we'll keep you posted on that. And recent research also indicates that there is perhaps long-term immunity once infected by COVID-2. By COVID-19. We're gonna keep our eye on this and keep providing updates. To the mayor's point, we're in for a few rough months here, but I see the light at the end of the tunnel here. We pull together, we wear our face coverings, we physically distance. Vaccine starts to get distributed to high-risk individuals, perhaps starting as early as next month. And as that continues to be distributed throughout our communities, I see 2021 looking a lot different than where we are right now. So with that, I will open it up to, I guess, turn it back to you, Teresa.
All right, thanks so much, Bob. Thanks, Mayor. And it is time for Q&A. If we have press on the line and you have a question, go ahead. Any questions?
Hi, hey, Bob, this is Conrad.
Oh, Vinny,
sorry, go ahead,
Conrad.
Vinny, go ahead, Conrad. You go first.
Vinny, let's go start with Vinny. We'll go to Conrad next.
Okay, thank you. Sorry about that. This is Vinny Del Giudice at the Bloomberg News, Mayor. What is the status of the city's emergency services, police, fire, 911, EMS, as far as COVID infections? Are many first responders off the job because they're in quarantine or have been infected? Thank you very much.
Vinny, great question. We have had, of course, cases in each of the departments, but not to the point where we have a large percentage of them in quarantine, at least in the last reports that I've received from the Department of Director of Safety. If Murphy's on, I'll allow him to address it, but there hasn't been any alarming numbers. We did have a bit of a bump in numbers in the fire department at one particular house that we got under control and we put in measures, but nothing that will impact our ability to respond appropriately to the needs of the people.
All right, Conrad, go ahead.
And we'll get you more specific information on that as well.
Yeah, hey, thanks, guys. This is probably for Bob. I know you just talked about the need to shift to community testing sites, which does make sense. But in retrospect, with those testing sites swamped at the moment, was closing the Pepsi Center at the same time the right call? Could that be used potentially in the future to handle any influx of demand for testing?
Well, if I understand your question, was it the right time? Yeah, I believe it was the right time. We knew that the Pepsi Center, when it was stood up, was just standing in the gap. We needed to get testing going, get as many people tested as possible to get ahead of this. But we knew that we weren't reaching the most vulnerable people based on the data that we were collecting. I think it was absolutely the right move. We have 4 sites now set up in some of our most underserved communities. And I already reiterated the data that we're seeing in terms of those individuals that we're trying to reach are most vulnerable. You know, cases are up right now, and so there's a lot of demand for testing, and we're going to continue to do everything we can to get everybody tested. The state's going to step in, and they're doing this throughout the state, looking at other areas where they can contribute to the testing effort as well.
All right, thanks, Conrad. Any other questions? We have Jesse and Seth also on the line. Either of you have any questions that you'd like to ask?
All right.
Any final questions, Conrad or Vinny? Any follow-ups?
Yeah, I'd like to ask another question, if I may, of Mayor or Mr. McDonald's. As far as hospital staffing, doctors and nurses, how many of them, have you gotten a rough estimate, are out of work because of this situation? And what is the prospect of actually tapping the National Guard for patient care personnel versus just support personnel? Thank you very much.
Yeah, Vinny, thanks for the question. I believe there are two parts to that. I don't have the data on, the number of people in the healthcare system. What I can tell you is that it's been strenuous on them. They are fatigued. Again, so we can do our part by helping them out. They've been some real heroes every step of the way through this. But I don't have that data in front of me. In terms of calling in state or federal resources to help out with that, those are conversations that are happening with the state health department, likely a decision that would be made at that level, and we'll keep you posted as things move forward.
Thanks, Vinny. Last question. All right. Mayor, any last comments?
Thanks, everyone. Appreciate you joining us. Thank you, Teresa. Bob.
Thank you, Mayor.
Thank you for joining us.
Finance. Michael Kerrigan is here for his annual visit to the Finance and Governance Committee.